Durango TV News brings you healthy living in the Four Corners, featuring experts on wellness, nutrition, and lifestyle to keep you healthy and fit to enjoy all the region has to offer. Brought to you by San Juan Regional Medical Center in Farmington. Thanks for watching Healthy Living in the Four Corners. I'm Deborah Uroda. The Center for Disease Control identifies October as the official start of the cold and flu season. Although there are no vaccines for the cold virus, the CDC recommends a yearly flu shot for everyone over 6 months of age, and now's the time to get vaccinated. Although you've probably heard about cases of people getting sick after getting the flu vaccine, in all likelihood, the person was probably infected with a virus before the shot, and it was probably a cold. So how do you know whether you have a cold or the flu? Nurse practitioner Nancy Brooker with the San Juan Health Partners Family Health Center in Aztec describes the difference.
Many people will talk about snot and sputum. So we've got a lot of secretions going around. Head congestion, runny nose, scratchy, irritable throat, postnasal drainage, and a lot of people will say, now it's moved into my chest and they've got a good productive cough. Low-grade fever, don't feel well. Patients will talk about feeling within 12 hours. They know that they are very ill. High fever, racking body aches, a hacking cough, headache, shaking because your fever is so high, feeling very ill, that's the sign of influenza. So it's the sudden, severe onset of symptoms that make us think of influenza.
Don't waste your money or time going to a doctor to get antibiotics for your cold or flu symptoms. They won't work on viruses, but you should go to your doctor if your symptoms keep returning.
If you become ill, you start to feel better, and then you get sick all over again, that can be a sign of a secondary bacterial infection. So you certainly would want to go see your healthcare provider. If you have an underlying chronic medical condition, such as cardiovascular disease, asthma, diabetes, you may want to go see your healthcare provider a little bit sooner.
If you do get sick, stay home from school or work to avoid infecting others. The CDC recommends that you stay home for at least 24 hours after your fever has abated. If you absolutely must go to work, use good hygiene to avoid the spread of infection.
You want to wash your hands all the time. You want to try not to sneeze and cough into your hand. You want to try to sneeze and cough into your elbow. You want to wipe down all of the electronics that you're going to use, your phone, your cell phone, your desk, your keyboard, because we know that viruses are transmitted by our hands. That's the most common way that we transmit. Try not to shake anybody's hand, give them the bump.
Of course, you want to avoid getting sick in the first place. Eat a balanced diet, get plenty of sleep, exercise regularly to reduce stress, and most importantly, get your flu shot.
Right now. Right now is the time to get a flu shot. Get yourself and your family vaccinated.
To find out where you can get a flu shot, contact your local health department or visit the San Juan Regional Medical Center website at sanjuanregional.com. Keep healthy this winter. I'm Deborah Uroda for Healthy Living in the Four Corners. This edition of Healthy Living in the Four Corners has been brought to you by San Juan Regional Medical Center in Farmington.